Okay, so we're already at week 3. In 2 weeks is our midterm, and then shortly after that, we'll be at finals. And then we have a break. And I know I'm saying it like, oh, it's right here, but it's going to go by so fast. So today we have chapter 6, diagnostic agents. Your mini session, chapter 11, is up, but if you have any questions on that, y'all, please reach out, let me know. We have some poll questions, time permitting. If we don't get to the poll questions, I'm going to still send you guys the link so you guys can still kind of use them at your leisure. I did pick, I think there's 15 questions from highly missed concepts from this week, from previous, as well as stuff that we've gone over that we're going to go over this evening. And I tried to make sure that it was like the two most pick choices, one's correct, one's the one that's highly chosen. Okay. But let's start off with our quote of the week. Our greatest weakness lies in giving up. The most certain way to succeed is always to try just one more time. As you train to become an ST, you're going to face many challenges, okay? Whether it's mastering proper handling instruments, show yourself some grace, or learning sterile technique, or managing just the pressures of being in a high speed operating room procedure. This quote teaches us that our biggest obstacle isn't making mistakes, because to err is human, right? Or struggling to understand something, but giving up when it gets hard. Success often comes from just trying one more time, even when you feel like you've hit it all, like you've hit a wall and you're like, I can't do this. Now, while you guys are studying and training, there will be times that don't go as planned. You may have already felt them as we're already in module 3, right? You may be struggling to kind of memorize instruments as we're in week 3, and there's lots of instruments. Or you may feel discouraged once you get to the lab or even clinicals. In those moments, I want you to remind yourself that persistence is the key. Every time you push yourself or try again, you're gaining not only experience, but knowledge, and most importantly, confidence, which is really big. Success in our world requires practice and willingness to keep going, especially when things get tough. Your hard work will pay off in the operating room where precision and perseverance are so important. So just remember that. And also, you guys, make sure you're giving yourself some grace. We do not expect you to memorize all of these instruments. There's no way. There is absolutely no way. I promise you. So, now from the mini session, I wanted to kind of throw in a couple little bells. Now, during surgery, I want you to remember that fluid replacement is so important because we want to keep our patients stable. We might fail to recognize or communicate signs of fluid loss because, we are multitasking. So just keep in mind that like blood loss or excessive irrigation can contribute to complications like shock and organ failure. And I talk about this a lot in the mini session. Um, we have to think about different strategies that we use interoperatively to help prevent this from happening. Okay. So we look at some of the things we do. We focus on fluid loss. Okay. We think about what we do to prevent it. In the operating room, we're going to make sure that the patient has some type of IV fluids, right? That's going to be one of the biggest things because we want to make sure that whatever's coming out of their body, we are replacing it. Now, granted, we're at the field, so our circulator is going to be doing a lot of those things. Okay. Now, for us, we have to think about what happens to the heart, the kidneys, or the brain if blood volume drops too low. We start with the heart. The heart's going to be trying to pump harder, 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 um, which is almost like a domino effect, right? Once you start having multiple system failures, eventually they all cease. Okay. So we also look at keeping track of irrigation. You guys are going to learn this in module 4 once you get in the lab, but what we do at the field, okay? And I think there was a question before, I think last week where we monitor. So for us, We are keeping a track of our irrigation. Whatever we give our surgeon to irrigate the inside of the body, we're also looking at our suction canister. All right. When we talk about IV fluids, that's more specifically for our circulator and the Foley. So think about it this way: IV Foley, it's going directly into the body, it's coming directly out of the body. For us, irrigation, this is what we're giving our surgeon. So we're irrigating and then we're handing them a suction. So we're irrigating, giving them fluid to go inside of the body, and then the suction sucks it out. Okay. Other ways we look at it is blood. So with our surgical sponges, we're handing them to the surgeon, and then we're looking at how much blood is on the sponge, but then we're actually putting it in our kick bucket, and then our circulator is checking that. So they're looking at a lot of different things, okay? So it's not just one thing when it comes to looking at fluids. It's irrigation Foley, or I'm sorry, IV Foley, irrigation, suction, and then our sponges, okay? But again, I break that down in the mini session. The other thing that I broke down is when we talk about our lactated ringers, okay? So let's tackle this together. When could it actually be harmful? We talk about looking at electrolytes, okay? You've probably memorized, if you've had the opportunity to check out the mini session, that lactated ringers, or LRs, what we normally say in the operating room, is used for rehydration and restoring electrolytes. But now we're going to go just a little bit deeper. We're going to be asking, when could it actually be harmful? And that means we need to think critically about why and how the body processes it. So we look at the core question. And so as we get closer to module 4, you're going to notice that the questions are going to be a lot more critically thinking. And so I want to kind of gear you guys up for that. We look at the core question. It's not just asking when we use LR, because that's what we normally think. When will we use LR? But it's actually asking, when might it cause harm? This means we're dealing with contraindications and clinical reasoning. So let's break it down. We ask ourselves, what is lactated ringer and how does our body metabolize it? We also have to think about what organs process lactate and what happens if that organ isn't working properly. So let's say the patient has liver disease and their liver cannot produce lactate. We think about what could happen to the body's acid balance base. Let's take another angle. Addison's disease. So Addison's disease, it affects our adrenal glands and it messes with hormone levels that regulate sodium and potassium. So the patient struggles with electrolyte regulation, and we give them a fluid loaded with electrolytes like LR. We have to think about what could go wrong. How might giving electrolytes to someone who can't manage them naturally worsen their condition? Okay, so we're getting ready to set up for our case. We're prepping a patient for a procedure. We glance at the orders and we see LR. And there are red flags in their medical history, like red flag, red flag, red flag, liver dysfunction, endocrine disorder. That's when we're going to speak up. Again, as we get closer to module 4, and I know I'm saying it, and you guys are like, we're only in week 3. It's going to go by fast. I promise you. This isn't about just memorizing drugs because you guys are going to be in the field. It's about knowing our patient, understanding the physiology, and again, we're the patient advocate. That's what makes our job is not just skilled workers, but we are extremely invaluable because we put on a lot of different hats. Okay. So I kind of wanted to break that down. If once you look at the mini session, it'll start coming together. But these are going to be some of the things that you're looking at beyond just this particular course. Okay. I've talked. Now let's get into diagnostic agents in chapter 6. Again, we had some questions in the beginning that I want you guys to think about as we go through tonight's live session. What does it mean to say that medication is contraindicated in a patient with a known hypersensitivity? We're going to answer that tonight. We have to look at procedures that use methylene blue placed in the bladder. We're going to talk about that. Okay. I do have imagery tonight, so just let you guys know that off the top. Nothing crazy, but just stuff that you're going to see. And then our learning objectives, diagnostic agents, radiographic contrast media that you may be using in the operating room. You may have to, with your circulator, mix it, or they'll give you the mixture and you'll give it to the surgeon. We use dyes in surgery. We're going to talk about that, and staining agents in surgery. And we're going to look at some different examples. Here's the background. Now, if we can't see, 9 times out of 10, our surgeon can't see. So if our surgeon is like, I can't see, trust me, they've got to be able to identify what's going on in the patient. Surgery depends upon visualization of tissues. All of these agents are going to give insights into position, activity, and health of internal structures. All of these agents just help the surgical procedure go smoother, making hidden tissues visible. And I have, like, when you see the images, you'll be like, aha, it makes sense. Now, most surgical dyes and contrast media are not listed in the PDR because the PDR focuses on medications that are actually prescribed or usually systematic. So that means they're for the entire system. Now, for us, our surgical dyes and contrast agents are used locally in procedures like imaging for our surgeries, not as general treatments. So these agents are also often categorized differently and may not even be FDA approved as traditional drugs, which is why they're not in the PDR. Okay. So in surgery, X-ray dye is usually, well, is actually a contrast media that helps improve that imaging that I mentioned. It's not a tissue staining dye, so make sure you understand the difference. So this is what you need to know, okay? Iodine in contrast media, always have to check the patient's chart for iodine or shellfish allergies because that can cause an allergic reaction. When we look at radiopaque versus radiotransparent, radiopaque substance block x-rays and show up white on images. You're going to see the difference. While radiotransparent lets the x-ray kind of pass through and it appears darker. So radiopaque contrast helps doctors see different structures clearly. Okay. We look at contraindications. So we know it's a reason that we're not going to give a drug. Okay. But I want you to also think of it as a red flag. If you see it, you stop and take action. In the operating room, our role isn't just technical, like knife, right? We're not just doing that. Again, we're the patient's advocate. If a diagnostic agent like an iodine based contrast could harm a patient, it is our responsibility to speak up. Okay. We look at common contraindications like a hypersensitivity to iodine or other agent. Now, iodine-based contrast agents actually can kind of trigger a severe allergic reaction, including anaphylaxis, which is a life-threatening thing that we do not want to happen in the operating room. So some patients might only report, oh, I'm only allergic to shellfish, but they often will signal to us that, wait a minute, shellfish, they may have an iodine sensitivity as well. So imagine the patient getting prepped, okay? And a contrast is about to be injected when you spot an iodine allergy on the chart. Your alertness is going to be like, wait, circulator Josephina, I don't know. I just noticed that that patient has a shellfish or an iodine allergy. So then immediately we'll make sure that we get rid of that and bring in like a Hibiclens or something else that can be used. And we'll definitely make sure that the surgeon is aware. Okay. Now, we also look at severe renal impairment where there is a risk of nephropathy. Now, this is important because diagnostic agents are going to be filtered through the kidneys, right? So if the kidneys are already compromised, introducing these agents can lead to contrast-induced nephropathy, which is a worsening renal failure, basically. And We also think about post-kidney failure can turn a successful surgery into a long-term complication, and it starts with what seems like just a simple injection. So this is why it's really important for us to kind of make sure we know. The chapter also talks about safety measures, right? We're always going to review the allergy history before we administer anything. Oftentimes, they'll do a pre-procedure testing if indicated. It's not something we do normally, but it may call for it depending on the case. We also keep emergency meds available, and histamines, epinephrine, it's always going to be somewhere on the anesthesia cart. Okay. Now, because it can be life-threatening, okay, this is one of the reasons why an iodine hypersensitivity understanding is so important. When we talk about adverse reactions, these are contrast agents that are generally safe, okay? But reactions can actually occur. As STs, we have to be able to recognize the signs early because, again, we're trying to keep our patients safe. So let's break these down. We look at some mild reactions that you see up there: nausea, they're starting to feel hot, maybe even a mild headache. Now, these may seem minor, but they can escalate or signal early signs of some type of intolerance. So we get a little bit moderate, right? We get to the moderate section right here. Now we're looking at hives or difficulty breathing. These indicate that, okay, wait a minute, there's a developing allergic response that requires some quick intervention to prevent it getting worse. Now we look at severe anaphylaxis. These are medical emergencies. Seconds, not minutes, actually count. The chapter talks about risk factors. You might want to know these. Um, let's say they had a prior contrast reaction, history of asthma, so they're higher risk of a bronchospasm, dehydration that affects the kidneys. Okay. Maybe they even have kidney disease. We also look at our response. Our circulator, our anesthesia provider, they're always monitoring the vital signs. Okay. Especially during and after contrast administration that sometimes we give in the operating room. They're looking at changes in blood pressure. They're looking at heart rate, or even breathing may signal, oh, wait a minute, hold on, there's a problem going on. We always have our crash cart. Once you guys get to your facilities, one of the first things your preceptors are going to show you or should show you is where your crash cart is and your malignant hyperthermia card is. Okay. So on the crash cart, there's going to be epinephrine, antihistamines, and oxygen is going to be available. And if you notice something unusual, speak up immediately. Silence can delay life-saving actions. So even though we don't administer drugs, it is so important for us to be aware. Our eyes and ears in the sterile field, like I mentioned, we wear lots of different hats. Also, once you get to your facilities, learning the location of your emergency supplies. And when you guys are practicing, try to stay calm. Easier said than done, but stay calm because calm communication is really important during these type of events. So we handle medications, okay? We're going to be inspecting these vials. Remember, I went back to trust verify. I trust you, but let me verify that vial as well. That is why our circulators not only tell us, but they show us, okay? We're looking, not just them, but we're also looking for damaged vials because that can compromise sterility and introduce contaminants into the patient's body. We're looking to make sure it's expired. That's why our circulator is showing us the expiration date as well, and we're both verbalizing it. What could happen if expired contrast is actually used? What do you guys think? What could happen? Remember, there's no wrong questions. I mean, wrong questions, wrong answers. It won't be potent, most definitely. It will not be effective. Now, those are correct, right? We want to make sure that it's going to work while we're in our procedure. I want you also to think of this. Even though contrast isn't a surgical instrument, it's going into a sterile environment or actually in our patient's bloodstream. We always maintain sterility when we're drawing up the agent, right? We have on our gloves. We're going to be scrubbed in. We're going to have our sterile syringe, and we're doing that non-touch technique. If warm solution is required, okay, keep in mind that warming the contrast, we're looking at the manufacturer's policies to make sure we do it right, but it does improve flow through catheters and reduces patient comfort. Granted, our patients are asleep, but still, okay? A way to think about pushing cold syrup through a thin straw versus warm syrup, or even honey. Like, maybe not, honey's the same. Okay, so the syrup. So if the syrup is warm, it will go through a little smoother versus if it's colder, it's kind of stuck. Okay, so kind of the same concept. Again, if it's not labeled clear, we're not going to use it. A simple mislabel could lead to the wrong substance being injected, and that causes harm to our patients. Now, we look at some different questions, okay? What does it mean for a medication to be contraindicated? What does that mean? With a yes or no, if it's contraindicated, would this be something we should give to our patient? Correct, we should not. Um, okay, we look at procedures using methylene blue. Okay, methylene blue is usually placed, we can place it into the bladder. Now, this one I'm going to give you because we haven't gotten there yet. When we do urology, so for those of you that are going to probably start off in urology and you're doing cystoscopies, and the surgeon's going to use methylene blue because they're going to want to identify the bladder integrity. So they'll do a bladder integrity test. So during cystoscopies, hint, hint, this is when you're going to be using methylene blue. Not all the time, but if they're going to use it, this is where they would use it. And when we look at the renal function question, why should renal function be evaluated before using contrast? Remember, if the kidneys, if the kidneys are poorly functioning, right, we don't want to risk contrast-induced nephropathy, okay? Because remember, the kidneys is what is excreting different things. Now, if we only memorize that renal impairment is a contraindication, you guys are going to pass the quiz. Check. But we want to be able to understand this because remember, we're we're like MacGyver. I don't know if you guys remember who MacGyver is, but we're like the Avengers. There we go. We're like the Avengers in the operating room, right? We're thinking 2 and 3 steps ahead. We're constantly scanning our field. We're making sure that that medical student isn't touching something that he's not supposed to. We're also verifying with our circulator. We're talking to our surgeon. We're watching our anesthesia. We are literally multitasking, okay? So now we're going to get into some dyes. Now, dyes are used in surgery for more than just visualizations. They do help mark skin for incisions. There's a question that constantly gets missed that we're going to break down tonight when it talks about the marker that's used for our skin. It also highlights organs or vessels during different procedures, and even color urine to track kidney or urinary function. We kind of just talked about that. It also aids in precise surgery and allows surgeons to kind of evaluate internal structures, integrity, and the function. Like I told you, we're going to get into some imagery. Now, staining agents in surgery help identify abnormal tissue that may need to be biopsied or removed. They allow our surgeons to clearly distinguish between healthy and some areas that are a little bit suspicious, or maybe they need more accurate treatment. So, one of the examples is Lugol's iodine during cervical procedures, where normal cells absorb the iodine and turn brown. So we look at this, okay? All of the normal cells turn brown, right? While abnormal cells, like carcinomia, stay unstained or appear lighter. So this entire cervix was had Lugol oil placed on it, but this section right here stood out. It didn't change, or it changed, but it's still lighter than the rest. This contrast helps the surgeon kind of target the abnormal tissue or biopsy, or even let's say they can come in for a hysteroscope and we can excise that during a hysteroscopy. Now, here are some examples of contrast media used in imaging procedures. So, this is from the chapter 6.1. So, omnipaque, the very first one you see, it's a non ionic, water soluble. It's used in CT scans to enhance imaging of blood vessels and organs. High pake, you're going to see a lot. Procedures like angiographies to really visualize blood vessels. Visiopaque, um, vascular cases, cardiac imaging. And IsoView, the bottom one, we use these in CT angiography to kind of really improve internal image clarity. And again, here in table 6.1, it's just different examples. Now, radiopaque or RCOM, ROCOM. These are classified into two types. You have ionic, breaks into ions dissolved in water, and non-ionic. These do not break down into ions when they're placed in water. Now, while not all contrast media used in surgery contain iodine, keep that in mind because you may see a question in surgery. Do all contrast media have iodine? No. Okay. Iodine-based agents are the most common. So that's where you can get that trigger. They are the most common because iodine blocks x-rays effectively and it provides our surgeons that clear image. Now, these are also non-iodine agents like, or there are some like gadolinium. It's used mainly in MRI. So, of course, we wouldn't be around it. But the one thing is we always verify the patient allergies to iodine or shellfish when using any type of iodine-based agent. And we do that right at the time out. Now, contrast media are used in radiology and, of course, in surgery because, again, I feel like a broken record, but we are trying to make these internal structures visible. As STs, we just have to be careful when we're preparing these contrast agents on our back table because they're clear. So, if you guys are learning that we have a lot of clear liquids on our back table and they can be easily mistaken for other medications on the sterile field. Now, high pick 76. This is the one that should not be injected into cerebral spinal fluid or directly into the carotid artery because it's not designed for that use. So just know it's just not designed for that. We look at post-operative cystograms. This imaging procedure helps us to look at, again, urinary bladder. So if you're doing a lot of urology, you're going to be in cystogram. So anytime you hear cysto, I want you to start thinking your urinary, kidneys, urology. So it'll be more urology services. It uses contrast media because now we're trying to highlight the bladder. We're trying to look to make sure there's no leak. So let's say we did a big kidney case, bladder case, and so they're going to put that to make sure that there's no leaking of urine. And we're confirming that it was indeed a successful surgery and the bladder itself is intact and functioning. Okay. Now, again, we look at iodine-based radiographic contrast medium. This particular omnipaque is water soluble. Okay. Now, we use these in retrograde urography. So again, we're still in urology. Okay. It's used to contrast or to visualize the renal structure and assess the actual urinary system. So we're not just looking at the bladder now, right? We're looking at the uterus, the kidneys, the medulla, the renal pelvis. We're also trying to see if there's any blockages. The contrast will highlight the renal entire anatomy, and that helps our urologists or your urology surgeons identify blockages or any type of abnormalities in the urinary tract. So when injected into the blood vessels, the iodine contrast makes the vessels like kind of pop up like you see. And now it should not be used again in patients with an iodine allergy unless, and this is kind of rare, they've been pre-medicated to reduce allergic reaction. That could actually happen. Of course, that's going to be the surgeon and the patient and anesthesiologist. We would just know that the patient was pre-medicated. Okay. So that was Onopaque. Now, IsoView, again, iodine-based contrast media. This is used in radiographic procedures for injecting into blood vessels. Now, this is used immediately after opening to ensure effectiveness. Okay, so this is one of those ones that we open it, we get it so that it can give the best um, options. Okay, comes in a couple different concentrations: 200, 250, 300, and 370 milligrams. You see, we place it cerebral angiography, so we're trying to visualize those blood vessels in the brain. It can also be used in CT enhancement because it improves the CT scan quality, and it provides detailed images of the head and body. And kind of see how we can get into the lumbar as well. Visiopaque, another one the chapter talks about. Cardio, okay, cardiographies. We're looking at the heart and blood vessels now. Um, we can use it in arteriographies, where we're looking at blood flow and detect blockages in the limbs, organs, and even the brain. We have um, peripheral venographies, where we're looking at veins specifically, and we're looking at limbs to detect issues like blood clots. This should not, I hint, because I have seen concepts, this should not be injected into the cerebral spinal fluid because that's not what it's meant for. Okay. It's available in glass and plastic bottles. So that's the other thing to kind of think about. Now, knowing which contrast media is safe for spinal infection or spinal injections is so important because, again, we're trying to avoid serious complications like damaging the spinal cord or other neurological issues. So just keep that in mind. This is not um, used for spinal injections. So now we get into our dyes. Dyes are substances that color the tissues or various medical purposes, enhance invisibility during surgery or diagnostic procedures. So we're going to be looking at a couple of them. The first one we're going to break down is methylene blue. This is going to be the one you use the most in the operating room. Okay. Methylene blue is permanent dye that can stain tissue and surfaces. So it has to be handled carefully. Okay. It comes in a 1% solution. It's available in 1 mLs, 10 mLs, or even 5 ml ampules, as well as what you see in figure 6.3. We use this for better visibility. I've used it with my surgeons in plastics, oral maxillofacial, urology, general, even ortho. Okay. We just have to understand how to handle it because it can accidentally stain. And we have on double gloves, but just know that. Okay. Isoflurane blue is another one. So this one is used to outline lymphatic vessels during surgery. And so that's why I grabbed 6.4 so you can kind of see that visualization. It helps to kind of identify the first lymph node likely to receive cancer cells. And this aids in cancer staging. These are those cases where the surgeon will remove certain parts and we'll send it off to pathology, and we kind of wait for the pathologist to let us know that we've gotten everything or I need more. Okay. Now, it's going to help the surgeon diagnose primary and secondary lymphedema, a condition that also causes swelling in the limbs because the lymphatic vessels are blocked. Indigo Carmine, another one I wanted you guys to kind of see. So this is to help color urine. Again, we're looking at the kidney function. So during cystoscopy, which is urology, indigo carmine helps to visualize ureteral orifices. So these are going to be the openings of the actual uterus into the bladder by coloring the urine. It's given through the IV so that it quickly reaches the bloodstream and color the urine effectively. Okay. Now, I have seen many miss this question, so I'm going to hone it in. Genitin violet, genitin violet, genitin violet. This is our marking pen. When you think of genitin violet, I want you to close your eyes and imagine yourself with a marking pen in your hand. Okay. The good thing about this is it does has antiseptic and antifungal properties. It's used to clearly mark skin incisions during surgery for better visibility. Again, our marking pen has genitin violet. Okay. But it also can be used topically to treat like oral thrush, yeast infections, or even kind of like fungus in the ear. Now, 6.5 is the universal marking pen that is in every set that you're going to have in your surgical career. Okay. This is the typical one. Now, there are other versions, but this is the one we usually use in every case. Okay. We use it not only mark our labels for our medications, our fluid, but we also, this is the first thing that we're going to give to our surgeon to mark the skin. Okay. So it is the genitin violet pen. All right. More staining agents. Now, again, we're going to break down Lugol solution and acetic acid. Now we're in urology, or not urology. Now we're in gynecological procedures. Okay. We're in OBGYN. So we look at Lugol solutions, strong iodine mixture. It's used in medical procedures, especially for staining during cervical examinations. Keyword iodine. Okay. Now, let's say the patient is allergic to iodine. We're going to get into the other one. But here, we're looking at normal cells. It absorbs less of the brown stain than normal cells. Let me just show you. Let's get into the picture. So we have C and D. One side does not have the Lugol solution. So if you close your eyes and don't look at the other one, right? And you're like, I can kind of see where, you know, it the tissue is abnormal. Okay, without Lugol on it. And so you would probably think maybe just the top, right? With just the naked eye. Okay. But then you place the Lugol solution on and you see how much more of the border is actually suspicious. Okay. The one thing about this is Lugol solution should not be used in a patient with, of course, iodine allergy because it can cause allergic reactions. Now, let's say the patient is allergic to Lugol solutions, right? Well, we have acetic acid. Now, this one is colorless, commonly known as vinegar in its diluted form. Again, this is used for cervical examinations as well to help visualize abnormal tissue. When applied to the cervix, it reveals the AWE, which is the acetyl white epithelium. What it does is it highlights potential abnormalities, kind of like with the logo, right? Now, again, this one is even more because here with the naked eye, when I looked at it, I was like, okay, maybe over here, right? Um, kind of suspicious. Just on naked eye, I'm like, that's me. But once we place the acetic acid onto the cervix, we see all of the abnormalities a lot clearer. So for us, understanding the effects of acetic acid on the cervix is going to be really big in helping our surgeons and doctors identify what the next step for our patients is. Does that make sense? Kind of looking at the different pictures and seeing, okay, how it works. All right, perfect. Okay. This is it, y'all. What questions do y'all have for me? Did I start the poll right quick? Okay. Now, for those of you who are watching, you are going to have the same opportunity as everyone here. Okay. I'm going to put the poll link in the archive section. And then for those of you who kind of want to look at it again, because again, these are the highly missed concepts that I have seen. Again, two choices. One, the correct answer, and one, the highly chosen answer. Now, these aren't word for word, which you'll see, but different concepts, as you guys know, can be asked 1,000 different ways. So I will start the timer and take your time. You have 7 minutes. Take your time, and we'll be back for the wrap up.
Mine won't scroll past question 3.
Is it still not doing it? I scrolled down to 15 to see if that would help. Let me get you the QR code and see if that'll help. Give me a second. Okay, see if that'll work. timer's acting up. We're at 5 minutes and 47, 48. So about a minute and a half left, you guys. See if I can. Okay, let me share the results. All right. So again, for those of you who are watching, I'm going to share the link to the poll in the archive so you will have the same opportunity that we all here did to kind of see the questions. So, we looked at a lot of abbreviations related to diagnostic agents. Okay. We discussed how radiopaque or radiographic contrast media are used in surgery, and we looked at a couple examples. We reviewed the purpose of dyes in surgery with examples of when they're actually used. One of the biggest things we took away from this evening is that we always check our patients' charts to make sure that they do not have an iodine allergy. Did it stop sharing? Hold on. There we go. I don't know what happened. It stopped. There we go again. Thank you guys. I might have clicked stuff when I was going through. So again, you should be able to see them now. Can you see them now? I hope so. If not, someone let me know. Okay, perfect. All right. Thank you, Miss Blanca, Marissa. Thank you guys. All right. So, for those of you who are watching this playback, how does the application of staining agents like Lugol solution and methylene blue contribute to the identification of abnormal tissues during surgical procedures? What precautions should be taken when administering iodine contrast media? And why is that important to check for hypersensitivities in patients? Our quote of the week: our greatest weakness lies in giving up. The most certain way to succeed is always try just one more time. With that, you guys, thanks for being here this evening. If you do have any questions, you guys let me know. I want you to have a wonderful rest of your evening, and I look forward to seeing everyone who can attend for tomorrow's live session. Good night, everybody.
I have a question if you're still here.